Professor Dr. Rukhsana Kausar, Pro Vice Chancellor, Rashid, Latif Khan University. In fact, I'm going to talk about suicide prevention and the causes of suicide, because we are celebrating the month of suicide. In fact, this is the week is celebrated in collaboration with Rashid Latif Professional Psychology. Suicide is a very important, very significant issue, and particularly in youth. Over the years, it has been seen that people have been committing suicide in massive level, and almost world over, it has been reported that 7 million people take their lives through suicide. Now, this is an alarming figure, and the majority of the people who are committing suicide are from middle income or low income countries, and which indicates that there are several factors, and pronouncedly the financial factor. An alarming thing is that we don't have any services available, and we don't pay attention to the factors which are causing suicidal ideation among our youth. I'm focusing on youth because in a study conducted by myself and my student 2 years ago, about 25% of the children studying in school had suicidal ideation. We were not allowed to collect data from the mainstream schools, and we gather data through academies, and we are not allowed to share the findings with the children, which is really indicating that suicide is actually, or suicide ideation is actually a stigma and taboo, and people are suffering in silence, and they are not taking any psychological help or facilitation, and they suffer in silence. And what we need to do is that we must come forward and provide such kind of a counseling platforms to this youth who is suffering and who are unable to share. And the major factors identified in that study were actually competitiveness and lots of pressure from the parents to perform good. And these children are unable to, and bullying behavior on campuses. So these two factors were the main factors which were identified. However, there are other factors, like, because this is a complex phenomena, risk factors could be ongoing depression, ongoing illness, person's own vulnerable personality, that they are unable to face the stress, and coping strategies, that they are using more of emotional coping strategies instead of practical focus strategies. And there may be very many factors, and it's not, the phenomena of suicide is not confined to this region, it's worldwide. There are seasonal factors associated with it, but the majority of the people who commit suicide are between the age range which is 15 to 26, and this is actually a youth, and we need to do something before it becomes really difficult and cope with it, this massive menace. And this is the third major cause of death in these days, and I hope that we are able to push it back before it becomes really late. Thank you very much, and I wish these two departments, that is RLPP as well as RLCWC, that they have, I commend their effort and I wish them best, and I hope they are doing commendable job to prevent suicide among students and young people, because they are offering these services. While I'm sitting in a setting which is medical, I would suggest and propose to my students, medical student particularly, please talk to somebody. If you are suffering, don't keep your emotions to yourself, because finding somebody suitable and talk to the person is something which would help you. And this is not end of the world. You don't have to perform the best, because you are elitist of the elite who is coming from colleges. You most probably would have topped your college, but here you are competing with the topmost people who are coming as a topper from different colleges and different background. So don't take it as a challenge. Take it as a, focus on your career, focus on your future, but health is more important than anything else. If you have any issue, please talk to the persons who are available around you, find a appropriate psychologist, talk to them, share your problems and find your solutions. God bless you, and thank you very much once again.